Cool. I just recorded a whole video to get up to check the camera to realize that it wasn't recording. So I'm doing another update really quick because I just did an update, first time in 2 years, where I kind of gave a really quick status update of where I am. I'm in a good place. I'm just about 20/20 vision. I'm a little off because I have a secondary cataract and I have a legit cataract in my left eye that has to be taken care of. So when you have cataracts forming, your crispness of vision goes down, and that perfect 20/20 vision is a little bit interfered with. So the reason I'm doing such a quick update to the last one was I went into my retinal surgeon yesterday. I'm noticing some visual changes, and I wanted to get checked out. I want to be proactive. And if I notice anything weird with my eyes now, I'm like on the phone, I'm in the office, I'm getting checked out. So what I'm noticing is that, there is some diminished night vision, and there's also a little bit of slight blurriness. I'm not a perfect 20/20 anymore. And I just wanted to make sure the retinas are okay. The most important thing in there is the retina. Everything else is pretty much like machinery and can be fixed with cataract surgery. So I wanted to go in and just put my mind at ease that my retinas are fine. I lift a lot of weights. I had a really brutal squat session, and then I noticed a little bit of cloudiness. So I was like, oh man, I better go get it checked out. And everything's cool. I went in, they looked at me, they said, retinas look fine. They're not budging. I do have some shimmering around the periphery of my vision where I was lasered, so I have some like scar tissue on my retina, which is totally normal. And in those areas where there's laser damage or scar tissue, I do get like a little shimmer occasionally, and I notice it when I'm like working out really hard and my heart rate's like through the roof. Retina surgeon said, like, that's fine. The retina is a weird thing. You got some scar tissue. It's like firing, and it's just probably going to be something that I live with, and that's just that's fine. It doesn't interfere with my vision or my sight at all. It's just a little distracting sometimes when I'm working out, and I get like a little pulsing. It's not even so much distracting, but just like makes you worried. You're like, oh no, are my retinas okay? But he said they look fine. It's going to take a lot to make my retinas move. He said I'm lasered like all around. So things look good with the retina. What doesn't look good is the secondary cataract in my right eye. My right eye. So I had a lens replacement here because my right eye, I had 2 vitrectomies, one with air and the other one with silicone. And that oil bubble being in there and the vitrectomy with the air bubble, usually within like the first year or so, you have a cataract surgery because cataracts form. It's just a side effect of vitrectomy. So I had a cataract surgery done there, and I had like perfect distance vision. I had an astigmatism, so I had to choose distance or reading, and I chose distance vision clarity, and everything was fine. But I have this secondary cataract. So on the 10th of February, right now it's the 23rd of January, so pretty soon I'm going to go in and I'm going to get a laser procedure done that's called YAG capsulotomy. And they go in and laser your new lens, and it clears your vision of that secondary cataract. So I'm excited to get that done and get this eye back to like crystal clear. And then the other eye, in a couple of months, I go in to see if I'm a candidate for a new lens called a toric lens, which is for people with an astigmatism. And hopefully, if I'm a candidate, that lens will allow me to read and see distance. And I'm super excited. I hope I'm a candidate for that, because if I go with the same lens that's in my right eye with my left eye, I will need readers for the rest of my life in order to read, which is, if you don't need reading glasses, then obviously that's better. I'm 48 years old, so I'm gonna need reading glasses eventually anyway. So if I have to go that route, it's not like the end of the world. I'll just use reading glasses and live with it. But I think it's more important for me personally to have distance vision rather than reading ability. So that'll be interesting. I'll post an update on that. What I wanted to say really quick before, because I can start to ramble about eye surgery stuff. I wanted to keep these videos super positive. I rewatched the video that I did last time, and I hope I didn't like scare people about the level of care that they're receiving or cause you to question your doctors in any way, because what my experience was very unique to me. I had emergency procedures done here in New Jersey, and then after those were done and I was stabilized, I went and transferred my care to like the best place in Manhattan, which the doctors were like amazing. And I saw the difference in the level of care that I received at the place I'm at now. And I have some regrets that I didn't just start there from the beginning, but I can't change that. That happened. So I have to kind of, live with, did I do my due diligence up front and make sure I chose the best doctor available to me? I have a lot of choice in the area of the country that I live in. You may not. You might have one retina surgeon in your like vicinity, in which case, like, hey, that's your options. But if you have options, or you live near a big city with like top doctors and stuff, do your due diligence. Make sure you choose the right ones for you. And then you won't have that question in the back of your mind. Oh man, did they mess something up? I don't think they did. I think the retina is just like a weird thing. Sometimes, like the scar tissue I have, like probably would have happened if I had this surgery anywhere. So that's all I was saying there. I hope I didn't like cause anxiety in people to be like, oh, is my doctor good? The vitrectomies are pretty straightforward procedures, and they're like overwhelmingly successful procedures, and I don't want you to be worried. But if you have options, do your research, make sure you choose like the best doctor for you. And then you never have to wonder, did I choose the best doctor? Because you did. I want to really post these videos to help people who are either on the verge of getting a vitrectomy, have had a vitrectomy, have questions about recovery or preparation for the vitrectomy. So let me know, because when I sit down and just start talking about these things, there's a million paths I can go, and I start thinking and rambling about like my experience. But if you want to hear something specific, or you have a question about what I went through, a specific aspect of it, just leave a comment. I'll see if I could do a video, or at the very least I will respond to your comments, because I have turned on notifications on this YouTube channel for my phone, so I get notified when you comment, and I'll respond and try to help people the best I can. But stay positive. It gets better. I'm in a good place 2 years out. I cannot complain at all. I have my vision. I'm so grateful to God, and I'm grateful for my surgeons and the care that I've gotten. I'm more than anything, I'm grateful that we live in the time we live in, because the level of medical care that's available now for situations like this that would have been life altering. We're super lucky that we have the ability to fix these things. So stay positive. Leave a comment if you want to hear anything specific, and good luck.